Greetings and welcome to your destination. You reach the Psychological Wellness Hub. We aim to help you build your knowledge and wellness around better understanding mental health and psychological concepts. Welcome back to the channel. Today's topic is geared towards answering this question. What is psychodynamic psychotherapy? Psychotherapy treatment, a quick review. It is a form of treatment that focuses primarily on mental health, substance use disorders, and other medical conditions, and many more. It is a journey of self-discovery and healing. Therapy involves you and your therapist working as a team. As a team, you work together to make connections with your problems so you can relate to those internal forces that keep the problems going. The team works together to look inside you as well as outside of you with the intention to understand the inner and outer workings of how the problem lives and breathes. You are the navigator, the therapist is a guide to help you understand and make use of your thoughts, feelings, actions, and perceptions. This is an effort to identify and, if necessary, make changes for the positive and to promote healing. What is psychodynamic psychotherapy? It is a form of psychotherapy treatment that focuses primarily on mental health, substance use disorders, and other medical conditions, as well as many more. A basic understanding of psychodynamic psychotherapy. As stated above, look at the name of this treatment. It clues you in to a little bit about it. Psychodynamic psychotherapy involves an insight-oriented approach to help you. We have internal dynamics or forces inside us as part of our personality makeup. These forces are our drives, motivations, wishes, desires, perceptions, goals, and more. At times, these forces or dynamics are in conflict with one another. A handful of psychological conflicts can be worked through over time if we face them. However, if we continue to avoid them, they become less consciously aware and cause problems outside of our awareness, like blind spots. This happens because they start building, or like a dam on a river, they start backing up. This can cause problems in our psychological functioning and body. As human beings, we are always thinking and behaving, even when we're not fully aware of it, both consciously or unconsciously. As humans, when we become distressed, we focus on that distress and become less focused on our thinking and feeling. We become less focused on our behaviors. Psychodynamic psychotherapy is a treatment model that subscribes to the idea that the above happens and we become more distressed and have larger difficulties. How does psychodynamic psychotherapy work? There are many ways to understand this. There are many different approaches or forms of psychodynamic psychotherapy. You and your therapist will work together to form an agreement upon the approach that may include psychodynamic psychotherapy. You and your therapist will check in at certain intervals, usually often in the beginning and more spread out over time. As mentioned above, psychodynamic psychotherapy is an insight-oriented therapy that looks at internal forces or dynamics within you. This looking within you will be a team effort by you and your therapist. Each meeting as part of the check-in will be opportunities to work together or to review previously covered material or a practice assignment, sometimes called homework. You will build on previously covered material or review new material. This generally involves talking about what is bothering you, a sort of meeting of the minds. This can happen in several ways. This can happen verbally, thinking internally, visualizing on a board, or openly examining your ideas, perceptions, thoughts, feelings, and behaviors. This is not only to determine how they play out, but how they affect you and what you want to do about that, if anything. Sometimes at the end of a session, your therapist will check in and summarize what you have covered and what to do between sessions to make changes as clinically necessary. Therapists may check in over the course of treatment to evaluate and adjust or make sure you're moving towards your therapeutic goals, or what you might refer to as your treatment goals. These might be ways of describing reducing something that is bothering you and ways to feel better. Psychodynamic psychotherapy can be done in a variety of settings. It can be done in behavioral health clinics on an outpatient basis. It can be done inpatient. It can be done in partial hospitalization settings, residential treatment facilities, intensive outpatient, or IOPs. It can be done in a person's home, in jails, nursing homes, sports medicine clinics, professional sports team locations. It can be done in person or by video. Psychodynamic psychotherapy can be done alongside other treatments and supports like psychiatry, mental health medication prescribers, group therapy, case management, recreational therapy, and more. Please see separate videos that will explain more on what these terms mean and expand on them further. Why does one want or need psychodynamic treatment? One has decided to be proactive. That is, they want to improve themselves in a situation before it becomes more problematic. If it has already become a problem, then seeking treatment is one way to resolve the problem or internal struggle. Some go when they might need help adjusting to a new life situation. For example, divorce or breakup, relocation or moved, job stress, marital resilience, or starting in a new role. What difficulties or problems can psychodynamic treatment be used for? Psychodynamic psychotherapy can be used to address many difficulties or internal struggles. We only address a number or a few here. These include, but are not limited to, things like depression, anxiety, personality difficulties, personality disorders, pornography addiction, gambling, bipolar disorder, schizophrenia, marital difficulties, communication problems, panic, writer's block, existential difficulties, and many more. What does psychodynamic psychotherapy look like? I'm going to read some examples of portions of an individual's treatment session with psychodynamic psychotherapy. Please note these are not real people, but their stories represent real scenarios. Listen while I tell you about the stories, listen for details of the treatment, listen to how individuals engage in their treatment and work towards their goals. Remember, this is just a snapshot of what this kind of therapy can look like, and there are many things happening that are not mentioned or elaborated on this example. It is not all complete in the description below. Mary is a woman in her 50s who struggles with anxiety and depression. Mary comes into psychotherapy treatment to help deal with these conditions, but also wants to be more outgoing and notices others take advantage of her. She meets her psychotherapist for the first time. She and her psychotherapist do an assessment in her first visit to establish a diagnosis or a working diagnosis that relates to her concerns. In addition, her therapist will be establishing possible patterns and working up ideas for approaches to work with Mary. If time allows in the first or perhaps the second session, Mary and her therapist will develop a brief treatment plan. This is basically a goal of Mary's that they will target in the psychotherapy treatment. Basically customize it around this goal. This could be possibly one or several things. For example, depression, anxiety, feeling victimized by others. The treatment plan will also help them decide together what approach they will be best suited for Mary's issues. Mary decides that she would like to work on her feelings about being victimized and how she would like to work through these. All humans have blind spots. Mary chooses an insight-oriented or a psychodynamic approach to her therapy. This approach allows her and her therapist to look at information that was not in Mary's awareness. Functioning and awareness was outside of her blind spots, which one can refer to as insight. Mary and her therapist begin by discussing and understanding more about her experiences with being victimized or walked on by others. Through several sessions, Mary becomes more aware of her nature of being a decent and nice person and how her focus on this desire often causes her to ignore red flags and maltreatment by others till it reaches maximum exploitation. Said differently, it's not till Mary has been lied to, scammed, let others take and take over and over again that she starts to experience real consequences that she can see. As she continued with her session, she became increasingly aware of the consequences, like her funds in her bank running low from loaning too much money, overdraft fees, people pulling out money because she lent out her bank card, consequences like people taking and continuing to take, as Mary feels bad if she were to say something because these people she helps are down on their luck. As Mary starts to face and learn from her behavior, she begins to learn that she sometimes helps individuals whom are appreciative and return the favor. However, she also helps out predatory individuals whom only seek to exploit her. She starts to learn that she is being blinded by her goodwill, as she labels it. As she continues with more sessions, Mary starts to explore this further as she learns about boundaries. We will talk more about this in another video. Mary learns that she does not provide goodwill unto herself by taking the position of helping herself. She gives out to others but doesn't fill up her own gas tank, leaving herself constantly running on fumes. Mary also learned about repressed guilt from her childhood when she was forced to take on an adult role of caring for her siblings before she was an adult herself. She was compensating for an adult parent whom also struggled with alcoholism. This information became available once her and her therapist looked deeper and outside Mary's blind spot. Through further sessions, she learned more about her defenses in her self-protection system. She learned how denial and rationalization allowed her to justify giving to predatory individuals. She learned that when she started to feel anger towards those individuals, she would engage in self-attack, another defense, by mentally beating herself up and making herself feel shameful for exercising her personal rights and feelings. As Mary became more aware of these defenses and improving her boundaries, she started to learn about the relationship between these and the connections to years ago growing up and being parentified or taking care of her mother and siblings. The guilt and the shame associated with this, in particular the constant put-downs offered by her parent with alcoholism, led to a fixed pattern, one that continued in adulthood for Mary. Through the narrative, tapes, or defenses called introjection, she continued in the present as an adult, and in this way her good will blinded her as she learned to describe it. Mary had now discovered the engine that drove her anxiety and depression, as she would offer care to someone else till her resources or psychological gas ran out. She would begin to experience feelings like anger towards the person she was helping, much like she did when she was dressing the hungover parent who would become angry at her. She would shut down with this parent to survive. Mary in adult life would experience her anger in response to her goodwill at the person she was giving it to, but would instantaneously, like she did with that parent, she would shut down that anger towards a person who was exploiting her and turned it on herself. Beat herself up psychologically while additionally feeling shame for having that emotion of anger towards someone else. This eventually led her to feel more depressed and anxious. She would start to help that same person again or someone else start to feel good and useful again till it reached the end of the rope. Then the feelings came back again and rinse and repeat. As she continued the treatment through further sessions, Mary became more gradually aware of this pattern through her hard work and with the therapist's assistance. She engaged in efforts to combat this self-protection system that was derailed and got it back on the tracks as she started to feel better. She looked further beyond her blind spots. She tapped into hope, resilience, and used her healthy anxiety instead of accepting destructive anxiety. See psychological wellness videos for more on this. Mary started looking at and facing her feelings instead of avoiding them and attacking herself for having them. It was hard at first, but Mary started asserting herself more and having more healthy boundaries with relating to herself and to others. This eventually got easier for her over time. As she continued therapy, her anxiety and depression became more manageable, where she was more in charge as she continued through the stages of recovery. Mary continued to feel freer, less weighed down, more relaxed, and more at ease with herself. She continued to help others, but in moderation. She was able to have a more keen eye for not beating herself up and to see the red flags for her or others' behavior that didn't serve her or their best interests. Mary's self-esteem continued to grow, and she had more fulfilling and meaningful relationships with herself and with others. To learn more about some of the topics described above, go to the other playlists on the channel. To learn more about being more effective and active in your psychotherapy treatment, please visit the playlist on psychological wellness skills and look for psychotherapy treatment skills to build your wellness in this area. We hope you found today's topic was useful for yourself or someone else. Let us know if it was by commenting below. Let us know what you would like to hear about or what topics could be useful to you by commenting below, and we'll take it under consideration. If you like what you heard today and would like to hear more from Destination Psychological Wellness Hub, please consider liking and subscribing to the channel. Go ahead and follow the page. This will help you get the newest content produced by the channel or page to you. Please tell all your friends and family about this channel and share this and other videos with them on this channel. Encourage them too to like and subscribe. And as always, we hope your psychological wellness continues to grow with us in this community. Thank you.